and Wellness College is a place for people to come and learn about their wellness, physical wellness and mental health, and to do courses that help them to self-manage and improve their outlook in life. It helps people gain control and balance in their lives and helps people explore difficulties and challenges and find ways through some of those challenges that come up in our lives every day. It is open to a range of different people, and we welcome people with lived experience to the college. We welcome people who are working in mental health, and we welcome carers and supporters and families. Anybody who has an interest in mental health is welcome to attend the Recovery College.
My name is Brian Toner, and I'm a peer recovery trainer for the Recovery and Wellness College at the Southern Trust. What that job involves is that I use my lived experience of having been a service user to co-produce and co-deliver courses in mental health and well-being. It's a job that I really enjoy. To be able to use your own lived experience to help others start out in their own recovery journey is very, very inspiring and very empowering. The main part of my job is that I design courses alongside service users, carers and mental health professionals. Courses that are designed to help people rediscover their own strengths, their own opportunities, and to take control of their well-being. Our courses are delivered in a wide variety of venues, from community centres to libraries to enterprise units. We're always open for new venues that are as inclusive as possible. The Recovery College is open to everyone. It's for service users, it's for carers, it's for practitioners, it's for members of the public. The college is for anyone who wants to improve their mental health and manage their mental well-being.
All our courses are co-produced, which means that people with lived experience and staff who work in services have sat down together and created the courses and decided what they think from their professional expertise and lived expertise, what is important for people to know, so that people can find their own way through their challenges and difficulties. The courses help people to take responsibility back and to reclaim their lives, discover new things about themselves and find out things that they used to know about themselves that they have forgotten.
We're very, very keen to encourage students to develop their learning and to move on and become trainers. We have a mentorship programme for people who want to do precisely that. Practitioners who get involved often say to us how the Recovery College has made them think in a different way about their practice, how it's expanded their knowledge base. We're very, very keen to encourage new students of social work, occupational therapy and nursing to get involved in the Recovery Initiative. It's the future of mental health services. It's growing all the time, and we're very, very, very keen and very happy to see students come along and get involved and learn more about how they can widen their professional expertise.
Hello, my name is Janine Mulligan. I'm part of the community mental health team in Trasna House in Lurgan. Co-production for me is working alongside people who have that lived experience and their carers to produce mental health wellbeing courses. I would really encourage staff to be a part of the Recovery College. You will find out things about yourself and it will help you grow professionally. It's a good time to be involved in this part of mental health.
From a service user point of view and from a carer's point of view and for members of the public to come along to a course where they're hearing information delivered by people with lived experience and also with people with professional knowledge, that can be really, really inspiring. It can be a real game changer for people who have felt maybe that they have no hope and they don't know what direction to take next. Often people will say to us that the Recovery College has really opened their eyes to new opportunities and new ways of maintaining their mental well-being. People have come to us and said that they felt that they were at the end of their journey and they didn't know which way to turn. And the Recovery College made them realise that there was hope and they could take control and they were ready to now start taking control and seize new opportunities.
We have a wide range of courses at the Recovery College. One of those courses is the Wellness Recovery Action Plan, otherwise known as WRAP. It's an internationally renowned tool for recovery, helping people to regain balance and control in their lives. We have another really useful course called Your Voice, Your Choice. And it's a great course for helping people to make the links between self-confidence and self-esteem and speaking up for yourself.
The Recovery and Wellness College will is an opportunity for service users, professional staff and carers to come together for the promotion of people's mental health well-being.
I would recommend the college because it makes you think more outside the box. It makes you learn new things and you meet new people, and the cup of tea is always nice.
At the Recovery College, I found I got hope, confidence, learned new things, met new people, had good laughs. So why don't you give it a try, see how it goes?
We welcome all of people who attend the college to come back as trainers. We give people opportunities to do more training, to become trainers, and we help people build skills and expertise so that they can be part of the college, be students as well as trainers. We welcome staff and we welcome service users and people from the public and from other areas of service who feel that they have something to contribute to the college. We would like to widen the brief within the Recovery College so that everybody gets an opportunity to learn something and everybody who's interested gets an opportunity to contribute.
It's for carers.
It's for practitioners.
It's for service users.
The Recovery College is for everyone.
It's for me.
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 It's just been such a positive experience in my life that I would love for anybody who's even thinking about it just to take that brave step and come along, give us a try.
Register with the Recovery and Wellness College today. It may change your life.
Morning everyone, I'm Lisa Morrison. I'm very nervous, so I've got my notes here, and if I lose my place, please just be patient and kind to me because this is quite intimidating. But I'm very grateful to have been given this opportunity, so thank you, Jacqueline, for that. I debated long and hard about what to say and how to say it. At the end of the day, all I have is my story and my truth as I see it, and that's what I'm going to share with you today. Just to provide a bit of context before I actually speak about what matters to me, I was given my first diagnosis at the age of 14 and put on my first antidepressant. For the next 30 years, that diagnosis changed many times and I was tried on many different combination of drugs. In October 2000, I moved to Northern Ireland after marrying a man from here, and I was referred into services a few years later. Although since teenage years I've had many admissions to acute psychiatric wards, a lockup ward and eating disorder units, I've also been very blessed to have spent many productive years working. I was teaching as a preschool teacher in South Africa and delivered teacher training workshops as well. When I moved here, I worked as a classroom assistant for a school for children with special needs, and my most recent employment was as a family support worker with SHSCT. I completed my BA Honours in Education in 2006 after having my second child. And to date, my most successful thing in life has been my two beautiful, kind, funny teenage children. In 2009, I had my first admission to Bluestone, and for the next 8 years, the frequency and the duration of those increased. Suicide attempts and self-harm kind of became the norm, and I was tried on many different medications, and the dose was continually increased despite the symptoms not improving. ECT was also tried on a number of occasions. Early last year, I was seen by a surgeon after a particularly severe self-harm attempt, and he bluntly told me that I had 6 months to live if I continued like I was, or I would be severely disabled. And that's really where I was at this time last year. And I'll go on a bit more about what changed for me later on. But in terms of that, what matters to me is this today is really being given a voice. I don't expect people to agree or disagree necessarily with me, but it's important that you hear and you listen and that my experience is validated. Being in recovery allows me to reflect on what has worked and maybe what hasn't worked so well, but I want to say in terms of that I am extremely grateful for the services that I have received over the years, and there are people sitting in this room who have been involved in my care who all delivered an excellent quality service. But like with everything in life, I believe it's important to reflect and look at perhaps areas where we can learn and grow, and that's what I hope to do today. But how does having a voice play out in a practical setting? Well, the mental health care pathway talks about personalised care, which is recovery orientated. So when I'm sitting to do a personal well-being plan with you, I want to be asked what matters to you. I want you to look at what are my strengths and assets, what's working for me, not just what about me is this cluster of symptoms and behaviours that you don't understand. I want you to help me identify what gives me hope, because without hope, it's very difficult to find a way forward and take personal responsibility for what I'm doing. I want you to consider that I'm part of a family, and my children and my husband and those around me are struggling with the confusion and the distress of dealing with me and my diagnosis. So please take into account that I'm part of something bigger than just myself. Lastly, it's important to me that I'm given options in my care, and in the pathway on, I think it's page 27, there's a wheel which kind of outlines the ideal of what options should be on offer. So what changed for me in April last year? Well, my mum, desperate really to, I suppose, save me, thought that maybe the self-harm was an addictive behaviour, and she got me a place in a private rehab in South Africa. That was paid for by my family. And there are three aspects to what I received in treatment there that I believe inform what I'm doing now in my recovery and what I would hope for the future in terms of that. And I believe that what I've learned is consistent with the values and the principles of the mental health care pathway agenda, which is why I'm going to share them with you. The first thing, the three aspects, the first thing was medication. They suggested that I detox off all my medication with my consent, and they wanted to assess me without any medication and then decide what, if any, needed to be given. That was a torturous process and took 2 months, but I managed, and I've now been a year off all medication after 30 years of being on different psychiatric drugs, and I've never been as well. They also found that they were treating psychiatric disorders in order to try and manage the symptoms of addictive behaviour, but they were finding that when the underlying alcoholism or addiction was being treated, the psychiatric symptoms in fact diminished. They also believed that treating somebody addicted to mind and mood-altering substances with mind and mood-altering substances is kind of counterintuitive. In terms of medication, my personal experience is definitely for the 5 years coming up to April last year, I felt like I had a chemical lobotomy. I honestly was physically unable to hardly get out of bed, feed myself, let alone take personal responsibility, engage in recovery college courses, or take any action really. I know my condition, it's complicated, but I did feel physically unable to do any of those things. But please don't misunderstand me. I understand that medication is it's an essential part of many people's treatment plan, and the medication is not the problem. It's just the approach of a very medical model to my condition didn't work for me. If I had to be put on medication again, I would like to see that there would be regular reviews in place, because I was put on increasing amounts despite my symptoms worsening. So it kind of wasn't making sense, because on top of my symptoms, I was unable to take care of myself on a practical level. Also, the long-term use of tranquilizers for someone like myself with dependency issues I feel is questionable, and I would certainly like that seriously looked at if it was ever considered for me in the future. Secondly, the staff there, although well qualified, all had lived experience of addiction issues and were living in recovery. Thirdly, basically what we did, and I believe what completely transformed things with me, is we had to do what RAP, the Wellness Recovery Action Plan. RAP describes a daily maintenance plan, and that's what I did every day for 5 months in treatment. I had to get up at 5:30 in the morning, Monday to Sunday. I had to shower. I had to do a morning meditation. I had to eat 3 meals a day. I had to do a chore in the house. I had to keep a journal at the end of the day. We were educated about our condition. We had to help other people in the house. So on a daily basis, I was encouraged and, can I say, challenged as well, because I think sometimes I was led away with things when sometimes maybe I needed a bit of a kick up the arse, to be honest. In light of those 3 things, what matters to me now is the Recovery College. When I came out of treatment, the Recovery College provided wonderful opportunities for me to engage. First of all, it's a place where I can educate myself about myself. It provides courses like RAP, where I can learn about my condition. I can learn how to identify when things start to break down. What I love about the college as well is that it's not a one-size-fits-all approach. You're provided with information and you're able to take that information and apply it to your own personal circumstances, because we're all different. So what works for one person is not necessarily going to be what works for another. Yet there's a lot of hope in the rooms, because, I say the rooms, I go to Alcoholics Anonymous, sorry, but there's a lot of hope on the courses in that people are sharing about what's working for them, and you can see people benefiting. Stephanie and I just finished a course, delivering a course, and people had been on it for nearly 8 months, and the change and difference that it made in their life was exceptional. As well as that, the courses are all co-produced, which means that it's not just a clinical or theoretical approach, but you've got lived experience, so it provides that balance. All elements are important, but there is that balance there. All of that and the opportunity that I've been given has helped me re-access skills that I feel I lost. It's also improved my confidence and self-esteem, and that naturally just benefits my recovery and helps me keep well. The Mental Health Forum is another place where I've been able to get involved, and I've been mentored and supported and encouraged to have a voice, share my experience, and these things have been very important to my recovery and well-being. Another thing that's really important to me is peer support workers. If I ever became unwell again, I would be loath to have to go into hospital environment. If I'm honest, I spent 8 years and I was a revolving door patient. I became dependent on a system where I didn't have to take responsibility. The environment was unstructured. And I actually learned what to say to get the tablets that I needed so that I could just be more out of it than I was when I already went in. And to be honest, when I went home, I didn't know how to cope at home because I wasn't doing the basics even there. And for me, it was a completely disabling experience. If I had to go as an inpatient again in absolute crisis, I believe anyway, I have no evidence, but I believe if I had access to a peer support worker, the duration of my stay in hospital would probably be shortened and my likelihood of readmission may be also decreased. But I can hear you saying, what about resources? In the introduction to the mental health care pathway, it says this, and I quote, "Although aspects of this care pathway may be challenging to implement immediately due to constraints on resources, it does commit health and social care services to make better use of existing resources and to secure additional resources to address gaps in provision." So what matters to me is that funding is made available to research the effectiveness of the likes of the Recovery College and peer support workers in helping people attain and maintain their recovery. It's important to me that information is gathered about how people do get recovery and how do they keep it, because there surely must be some common themes from which we can, extract and apply those to the services that are being delivered. Now, I'm no mathematician and I honestly have no head for numbers, but I can share this with you, that I spent many months of every year for 8 years as an inpatient, costing about £450 a night just for the bed, without the psychiatrist or medication or anything. One example of many was I spent 4 months after severing my artery. Now that would have cost over a staggering £50,000 for me to stay without the psychiatrist, without the medication, without the operation or the follow-up therapy to restore movement to my hand. I'm almost embarrassed to say that that's what I cost people. And yet, if I was to ask or want access to a peer support worker in my home costing £8 an hour, even if they were coming in 6 to 8 hours a day for a week, one night in Bluestone would cover that cost. And yet I would be able to keep my independence and maintain that at home. So, I do have to question those things. As I say, I don't understand the complexities of it, but I do wonder. What matters to me as well is better access to all the therapies that are on offer on page 27 of the pathway. When I returned from treatment, the treatment centre and my consultant here agreed that I needed further support around trauma resolution and a possible relapse into eating disorder behaviours. The only option I had about trauma was to go to psychology. My experience of psychology was rehashing old trauma, which re-traumatised me, rather than having specific trauma counselling. And even if I did have access to that, there would be a year's waiting list. The eating disorder team felt they couldn't help me because I didn't have full-blown symptoms of an eating disorder. Yet I knew, because I was educating myself about myself, that I had the potential for relapse into these things, and I desperately wanted to maintain my recovery. I have to say to myself, surely prevention is better than cure. So I accessed private therapy I won't go into that, with someone who's experienced in the range of the things that I'm battling with. And now that all the PIP reviews are in and a lot of people are getting those cuts or taken away, if that happens to me, I'm going to be hard-pressed to continue to afford that because I'm already getting help from family. So I have to question where resources are being focused and the long-term cost, both financial and personal, of not helping people like myself maintain their recovery. In terms of service delivery, what matters to me is that everybody delivering services at whatever level is valued and supported and properly equipped to deliver a quality service. Is my key worker who spends every week with me given the same value and input as the consultant who I see for 20 minutes maybe every 3 or 4 months? Is the peer support worker on the hospital ward being afforded the opportunity to have that one-to-one interaction with patients, or are they being expected to do other things on the ward that is not part of their job description? I don't have the answer to all these questions, but it is important to me. An example of this, which brought this to mind, was I was doing mental health care pathway training a few months ago, and there was a person on the training who would have done one-to-one continuous observation on me when I was in Bluestone. Now, the procedure recommendations for anyone doing that is that they are well equipped and that it is a therapeutic intervention that's offered. So she had a lot of access to me and we had a lot of one-on-one time to spend together. Yet on the training, I overheard her say, "I don't know why I've been sent on this training. It has nothing to do with me." Shouldn't everybody be buying into the values and the principles of the pathway, that of being recovery-focused, if a quality service is going to be delivered? But to conclude, what matters to me most is this, because without this, I believe the best theory, the best practice, and the best application of it will fall short of its potential. And that's something that my key worker and my mother gave me. They held hope for me when I had no hope. When I had completely given up of ever getting my life back, they remained there. They remained non-judgmental. They were at the other end of the phone. They supported me. Carl Rogers puts it really well. He says, over the years, the research evidence keeps piling up, and it points strongly to the conclusion that a high degree of empathy in a relationship is possibly the most potent and certainly one of the most potent forces in bringing about change and learning. So to conclude, what matters to me is that you see me, the human being, not me, a cluster of symptoms and behaviours that simply are outward reflection of the pain and turmoil that I'm struggling with inside. Access your humanity, because I could be your mother, I could be your daughter, your sister, or your friend. I'm simply doing my best in a world I do not always understand, just as you are, I'm sure. So please don't judge me or treat me, but rather come alongside and let's figure this out together. Thank you.
My name's Margaret. I became involved in the SAI process with me and my husband Gary from the death of our daughter Emily, who died of sepsis in 2017. At the first meeting we met one of the consultants and we met one of the clinical governors, and we told our story. You could see that it affected them both, and then we were kind of told that things would be taken and put into place, and the SAI was taking place, and it could take a couple of months, but hopefully that it would have been as quick as possible so it wouldn't put more pressure on us. I was pleased that they were going to be investigating it just to see how things were going to pan out, kind of thing. It was kind of hard because then you knew that something was wrong, but I was glad that they were doing it. Your head's all over the place, you don't know what's happening. You think that there's cover-ups because these things aren't being explained to you. But also you feel glad that people are actually listening to what you're trying to say and that there's things been taken into account. At the very start, you kind of said that you would keep us informed, and from our point of view, it was kind of, yeah, they say this, but they probably won't. We were informed at each stage. All of the questions that we asked, some of them were answered and some of them weren't. It kind of made us feel a bit down that we weren't getting the proper answers that we kind of wanted, and we felt that some of the way through it we had to encourage some of the answers. When we look through your notes, we find different things that weren't involved in it, and then when the final copy came through that they were, because we had put our input into it. We were listened to throughout the process. That was very important. To get an understanding of who was involved, to meet people, that we were part of it and that we weren't kind of pushed to the side and things happening behind our backs, kind of thing. So that would have been the most important thing, that we were linked into it the whole time. I would say to other families who are going through the same situation, to be involved and to stay involved throughout the whole thing. It's so hard, and it's really upsetting what you find out and what you read, but it's so good to know that you're part of it and to know that you're dealing with whatever happened along the way for your family. The message I would give to professionals would be, listen to the families, take into account their views and what happened. Be compassionate and caring towards them and ensure that they understand what's going on throughout the whole process. Me and Gary both think the process went extremely well. It helped us through the bereavement process, that we got answers from what had happened. It'll never change what happened, but hopefully it'll make a learning curve for other people.
Hi, my name is Kevin Sinnott. I'm a volunteer for Macmillan Cancer Support based in Craigavon Area Hospital and the Information Centre. My role is to open the centre and stock the shelves with information from Macmillan on a range of cancer issues, from finance through to health and healthy living. Our role is really to meet members of the public and anybody else who is suffering from cancer and provide them with information, or to send and post them to people who are more expert on issues such as finance. Person-centred care for me is actually treating everybody very much as an individual. It's just like I would like to be treated. Quite often you arrive in a place and you are, as people say, a number, and you're in a queue and you go through it and you're treated and you're moved on. But for me, it's just talking to someone. Quite often people come into our centre and whilst they're looking for information, they actually just want to talk to someone who's not a medical person or a member of their family, so they can just offload and have you as a soundboard, and you can give empathy or sympathy, whichever you like to call it, and just treat them as an individual and listen to what their problem is for that day. It may only seem like a trivial thing to you, but to them it's their whole world. So for me, that's the key for it. Treating them as a person, treating them as an individual.
Hello, my name is Jane Hill. I work as a staff nurse in the cancer services within the Mandeville unit in Craigavon Area Hospital. I have undertaken a new role, which is clinical lead nurse for the ZIP CAN project, which is co-producing and implementing person-centredness in cancer nursing. We as nurses provide safe, effective, high-quality care to each individual, although measuring the quality of nursing care is not easy. Therefore, within this new role, it will help us measure what matters by co-production. Co-production is not just a word or a concept. It is a meeting of minds coming together to find shared solutions. In practice, co-production involves the people who use the services being consulted, included, and working together from the start. When co-production works best, the people who use the service and carers are valued by the organisations as equal partners. They can share their power and have influence over decisions made. It refocuses on the fundamentals of nursing and a desire to improve the patient experience.
My name is Barbara Bailey. I was diagnosed with third stage breast cancer in 2008. While this was a tremendous shock, I had very good support from the consultant and the nurses who were looking after me. While I did feel as though I was on a conveyor belt at the very beginning, I did feel that I was cared for because the nurses and the doctors did listen to me. My after treatment care has been excellent. I have had to do self-drainage. I've been left with a lifelong problem in which I have to drain at least 3 times a day to keep myself from having infections. My consultant has worked tirelessly with me to get this right, to get this drainage right. We've had a couple of blips, but I feel now that I am on the right road in doing my self-management in the drainage of my breast. My consultant has now said that I do not need to see her for a year. She is so pleased with my progress. The physios have been excellent, very caring and very helpful. But my mindset is, from my whole journey, that I was valued, I was cared for, and I was listened to. And I have been kept out of hospital now since 2016. And that is very important to me. Thank you.
Hello, my name is Maria Tynan. I work as a Macmillan Specialist Dietitian in the Southern Trust.
Hello, my name is Edale Cardy and I'm an Oncology Specialist Dietitian in Craigavon Hospital.
Many people have eating difficulties during and after treatment for cancer, and cancer care can vary from a few days to months or years.
And we know that it is vitally important to screen and identify people who are having difficulties and ensure that staff can give them the best, up-to-date nutritional advice. So we have developed this guidance document with the help of other staff across the Southern Trust and patients from the cancer user group.
It contains a nutritional screening tool, information and practical advice on common difficulties such as weight loss, nausea, sore mouth, diarrhea, and how to support people in carers who are struggling with loss of appetite.
Thus far, we have carried out training for staff who work closely with this group of people, and more training is planned.
If you want more information, go to the Southern Trust intranet and look under the electronic directory of services, and if you go to Southern Guidelines and search for nutrition.
If you are a patient or a carer and you have queries or concerns, contact your healthcare professional for advice who may suggest referral on to a dietitian. Thank you.
Hi, my name is Caroline Davies. I'm the Macmillan Health and Wellbeing Support Worker. I'm based in the Macmillan Information Centre in Craigavon Area Hospital, and I'm just here to talk about what person-centred care means to me. Basically, it means that everybody should be treated as an individual, and we need to remember that even though someone has the same sort of symptoms as another person, that their needs aren't necessarily going to be the same. And it's basically tailoring our care and our support towards them and listening effectively to what they want and what their needs are and what we can do to help that particular person, and not just assume that we know best.
Here in the Mandeville unit, we do our utmost to provide person-centred care by offering high-quality, coordinated care and support throughout treatment. We involve the patient at each step of their journey. For me, it is about looking beyond a disease or a diagnosis and to find out what really matters to that individual and meeting their needs. We rely heavily on service user feedback and have patients involved in our steering groups in any improvement project that we have embarked on.
It comes as no surprise that cancer patients can worry about spread within their body, but also cancer spreads from day one to all aspects of their lives, especially throughout their family circle. If we want to deliver on person-centred care, we must involve the family, however that is defined by the patient. Good communication is vital. George Bernard Shaw said the biggest problem with communication is the illusion that it has taken place. So honest communication about the physical, psychological, social and spiritual issues helps us formulate a plan in partnership with the patient and their family, which is more likely to be successful and satisfy all parties. This will only happen, however, if it is realistic and deliverable with dignity and respect. With person-centred care, patients do better because life is 10% what happens to us and 90% of how we react to it.
Hello, my name is Ethna McLinden. I'm now 52 years old and I worked as a primary school teacher. In January 2014, I was diagnosed with triple-negative breast cancer. And when you hear the words you have cancer, your head just goes into a spin and your life becomes a roller coaster. The evening I was diagnosed, I attended the triple-negative assessment clinic just for peace of mind, given that a recent mammogram had read satisfactory and nothing had prepared me for what was to follow. But the manner in which the consultant conveyed this horrific news to me, however, instilled a great sense of confidence and positivity within me, and this gave me the strength to face the dark road that lay ahead. From the initial consultation through to surgery, follow-up appointments, I was blessed with a continuity of care from a consultant and a clinical nurse specialist whom I felt they took the time to get to know me as a person. They listened attentively and they took on board my anxieties and concerns, and when planning an appropriate treatment path for me. I had the greatest confidence in them both, and I trusted them to do their job that they knew best. Looking back on this experience, I firmly believe that I received the highest possible standard of person-centred care available, and no words can express the positive impact that these two individuals have had during the most terrifying experience of my life. Anyone who has had chemo will know that there just aren't the words to describe it. It's only the dedication and the commitment of the staff within the Macmillan unit that carry you through it. Having had a double mastectomy, immediate reconstructive surgery, 6 cycles of chemo, nipple reconstruction and tattooing, and 2 surgeries on my left lung, I have spent many a night on a hospital ward. Whilst the majority of these days were comfortable, I feel that there are, if you're really serious about implementing personal-centred care, much needs to be done to bring our nurses back onto the wards, to allow them to interact and to care for their patients instead of the huddles that, to the visiting eye, they just seem to congregate around the nurse's station. When sickness comes, and you are just so, with sickness comes an immense vulnerability. Post-operation, the initial days, you are 100% reliant on the care of the nurses and the support staff.